Hello and welcome to Impact Insights, PS Kenya's quarterly news update, where we spotlight the impactful work shaping the lives across the country. I'm Jadida Chepkosgei, and today we are looking back at some of the remarkable interventions that defined the last quarter. Let's dive in. Our first story takes us to DECIPCON 2025, where stakeholders gathered to discuss transformative approaches to family planning. Fidel was there to capture key moments. Over to you, Fidel.
The National DECIP Dissemination Conference 2025, held on the 30th of January 2025, brought together government officials, partners and key stakeholders to reflect on 6 years of transformative impact in family planning across Kenya.
Some of the key successes that we are celebrating is the increase in modern contraceptive prevalence rate that we have seen, with Kenya being an exemplar country.
Under the theme, Reaching the Most Vulnerable to the Last Mile, reflections on innovative family planning practices, discussions focused on sustainability, innovation and the future of equitable reproductive health services.
Time is changing, and I think Kenya must come to the reality.
Next, Cheryl brings us insights from Nairobi County, where Accelerate Program Development Partners experienced firsthand the impactful work being done to improve health services, especially on matters of sexual reproductive health.
On the 7th of January 2025, PS Kenya CEO Dr. Magwen Njenga, together with representatives from the Embassy of Denmark in Kenya, led by Halima Zaid, Program Manager Gender and Sexual Reproductive Health and Rights, and Jacqueline Brild, Team Lead Global Health Issues, paid a courtesy call to the Nairobi County Health Offices. The meeting focused on the progress and transformative impact of the Accelerate program in advancing sexual and reproductive health services in Nairobi's informal settlements. This collaborative intervention showed the power of partnerships in addressing critical health challenges faced by underserved communities. The discussions reaffirmed PS Kenya's commitment to improving health outcomes, enhancing service delivery, and driving sustainable change in Nairobi's most vulnerable areas. Reporting for Impact Insights, I'm Cherry Lodiero.
In Narok County, the Adolescent 360 meeting brought together experts and youth leaders to advance health solutions tailored for young people. Fidel has more on this impactful event.
Narok County hosted a 3-day cluster meeting from February 11th to 13th, 2025, bringing together health professionals and county directors to discuss key strategies for improving adolescent, sexual and reproductive health across several counties.
I also want to confirm that I'm happy about the efforts that we are making as a team towards ensuring that we have adolescents in our society who are self-reliant.
The meeting focused on the A360 program and its efforts to institutionalize adolescent health initiatives within government systems. During the sessions, the A360 program's accomplishments were highlighted, demonstrating notable improvements in ASRH metrics and the program's long-term viability. A key focus of the meeting was the discussions of A360's sustainability plan. Reporting from Narok County, my name is Fidel Castro.
And finally, Patrick reports on dynamic social enterprise training designed to equip makers with tools for sustainability and growth. Over to you, Patrick.
On February 11th, the Social Enterprise, Warehouse and Procurement Departments of PS Kenya held a collaborative session to ensure that every product reaches consumer with the highest quality and care. The session focused on improving efficiency, strengthening logistics, and upholding PS Kenya's commitment to excellence. By working together, these teams are making a real impact, ensuring that essential products are delivered safely and effectively. With collaboration at its core, PS Kenya continues to drive better health and well-being for all. Reporting for Impact Insights, I'm Patrick Mungai.
At PS Kenya, we believe knowledge is one of our biggest strengths, but it only makes a difference when we use it, share it, and learn from it. Knowledge management is simply about collecting what we've learned from our work, from each other, and from the communities we serve, and using that to do better every day. It shows up in many ways, from team reflections, learning sessions, saving documents, and using data to guide our action. This helps us avoid past mistakes, make faster decisions, and grow together. Whether you are out in the field at your desk or working behind the scenes, you have something valuable others can learn from. Let's keep sharing what we know, because when knowledge flows freely, we all move forward.
As we bring you the final story in this quarter's roundup, we take a moment to reflect on the transformative program that officially concluded this March. After 6 impactful years, the Delivering Sustainable and Equitable Increases in Family Planning has wrapped up its work, leaving behind a legacy of improved health access, equity, and resilience across Kenya's undeserved regions. Launched in 2018 and funded by the UK's Foreign, Commonwealth and Development Office, DESIP set out with an ambitious yet urgent goal to expand access to modern contraception in 19 counties where reproductive health services were often out of reach. From its earliest days, DESIP prioritized inclusion, reaching rural women, adolescents, and persons with disabilities. Within its first year, the program delivered over 433,000 couple years of protection, surpassing its target by over 20%. Nearly 60,000 new family planning users were reached, many of them living below the poverty line. And that momentum only grew. By 2021, DESIP had delivered over 779,000 couple years of protection in a single year, reaching more than 130,000 new users. 9% of these were adolescents and over 1,100 were persons with disabilities, demonstrating the program's commitment to right-based access for all. When the COVID-19 pandemic struck, DESIP adapted fast, shifting to virtual engagement, launching mass media outreach, and strengthening community-based distribution. These innovations helped mitigate service disruption and reached an estimated 11 million people during a time of global uncertainty. Equally significant was DESIP's role in policy and sustainability. Through strong advocacy, domestic funding for family planning commodities increased from just 6% to as high as 46%. Over time, more than half of supported facilities achieved NHIF accreditation, helping counties build long-term resilience and self-reliance. The journey, however, was not without obstacles. Stockouts of contraceptives affected up to 30% of facilities at one point, and delaying in budget disbursements created gaps. But DESIP responded with targeted solutions, working with government partners to strengthen supply chains and keep services running. In its final year, even after scaling down from 19 to 12 counties due to budget cuts, the program stayed focused, supporting national policy shifts, empowering county health teams, and amplifying the voices of women and youth who had long been left out of the reproductive health systems. As DESIP officially closed in March 2025, its legacy lives on. In the strengthened systems, in the lives saved, in the women and families who now have the power to plan their futures, and in a health sector that's better prepared to meet the needs of all Kenyans, no matter where they live. DESIP might have ended, but its impact continues to grow. And that wraps up this quarter's edition of Impact Insights. Thank you for joining us as we celebrate progress and innovation across Kenya. For more details on these stories and others, visit our website at pskenya.org. Until next time, I'm Jedida Chepkosgei.